So I guess I had nothing better to do than not breathe and I have to call 911. So like I have always been so afraid of having to call 911. Like it was always just this huge fear of mine, whether it be me having to call for someone or someone having to call for me. And I've always thought about all the different kinds of scenarios. Like I've thought through so many different things that could have gone wrong, could have happened. But I never thought it would be where I could not breathe. Like I could not get a breath in. It was the scariest moment of my whole life. I still think that I had an allergic reaction to albuterol, like a rescue inhaler. Everything got blamed on anxiety though, and it's a huge issue that I have. I've said it so many times, I'm sure already, but whenever there is some kind of physical problem going on, as soon as the doctors find out that I have anxiety, it all goes straight to that. So I had been sick for a couple weeks, and of course with all of this coronavirus stuff going on, I had no idea what I had because I had all of the symptoms for coronavirus. I kept putting it off because I kept telling myself, you know what, until you get a fever, you're fine. It's just something else because I'm always getting sick. I have had bronchitis, I've had pneumonia, I've had pertussis, I've had mono, I've had just so many random illnesses. Like I never just get the cold. I always have some kind of sickness. So I figured it was just something else because I hadn't been in contact with anyone. I had been working from home already. Like I wasn't around anyone who had it. And so I kept telling myself until I get the fever to just not worry about it because it seemed like that was the biggest symptom, would be a fever. And I didn't have it until one day it started to go up in like 99. And I'm like, okay, well it's still not technically a fever. It had just gotten to be like barely a low grade fever. And then it did end up getting up to 100.4. And that's when I'm like, okay, well, chances are I don't have it, but the symptoms all kept getting worse. So the biggest symptom was not being able to breathe. And I'm sure you can still hear in the voice. I had been coughing non-stop for days. For weeks I had been non-stop coughing. And of course I had all the symptoms of coronavirus. So because of that, no doctors were willing to see me in office. So I had to just basically wait it out, and I had doctors calling in prescriptions for me without even seeing me in person to try to diagnose whatever it may be. So in November I had bronchitis. It was borderline pneumonia, so I had just been treated for that again. So I had been prescribed steroids, which I hate. Steroids, cough medicine, antibiotic, breathing treatment, and a rescue inhaler. And I'm pretty sure that I am allergic to albuterol. And every time I say that, doctors look at me like I'm crazy. And when I explained the symptoms to actually a pharmacist, he said it's very rare to be allergic to albuterol, but it sounded like I was, and I'm pretty sure I am. So there were nights where I just felt like I could not breathe at all, because it just felt like there was, like, I don't know, if something in my chest or just whatever the feeling was that I couldn't breathe. I panic, of course, because when you feel like you can't breathe, of course you're gonna panic. So then it was feeling like I couldn't breathe, plus then I was getting actual anxiety on top of that. So it was hard to decide, like, okay, am I feeling anxious? Am I feeling sick? Am I feeling something actually in my chest, in my lungs? Like, I would have bet anything that I had at least pneumonia in my lungs for how it felt that I couldn't breathe. Because there had been times I didn't even feel anything to be anxious about. It just started like out of nowhere. And then one day, trying not to get nervous talking about it, one night it just got so bad. It felt like I couldn't breathe. It felt really tight in my chest. And then it just kept getting worse and worse and worse. And the thing is, I had been told by the doctors before that I have asthma, but then I would go for the follow-ups for the appointments about it. And then suddenly they tell me you don't have asthma anymore. And I'm like, okay, so I stopped taking my asthma medication and I no longer had a rescue inhaler. And ever since then I've been afraid, because like, okay, well, how do I know if what I'm experiencing is asthma or anxiety? And they're like, well, you'll know because you won't be able to breathe. And I'm thinking, you clearly have never had a panic attack then, because it feels like you can't breathe. So anyway, back to this night when it got really bad. It felt like a panic attack because I was panicking over the fact that I felt like I couldn't breathe. So I started to get this really bad panic attack, could not calm down for anything. Like, it's so hard to talk about. I tried opening the door to get air outside. I tried just like everything I could possibly think of to just breathe and calm down, and I couldn't. So I'm thinking to myself, okay, well, this might be where I need to use the rescue inhaler. So I used it, and I know albuterol makes you extra anxious, of course. It makes your heart race. I understand all of that. But it made it to the point where my panic attack had escalated. But not only that, I felt like it was an anxiety, and this is so afraid. I mean, I'm afraid of this. Like, it's so hard to talk about it. I got to the point where I had, like, my parents were like yelling back and forth at each other. They're like, it's just anxiety, she just needs to calm down, just help her calm down. And I'm trying to get out, like, no, this isn't anxiety. Like, I know it's not. Like, I just could not breathe. I know a panic attack, I've had so many of them. It was that plus something else. It was like I was allergic to the albuterol or something, because it got to the point where I could not get a breath. Like, I couldn't hyperventilate, I couldn't do anything. everything just like went still, and like I could not breathe. I could not get a breath in. And of course I panicked, because I mean, that was the scariest moment of my entire life. I could not get a breath in, and my mind started to go places that it shouldn't have, and just I kept thinking, so this is what it's like to die, when like you actually can't breathe. And I saw everyone around me, the panic in their eyes, the panic in their voices, me begging for them to call 911, because they kept saying, no, it's a panic attack, you're fine, you just need to calm down. I'm like, no, this isn't a panic attack, it's something else. So eventually we called 911, which nobody's phone was working at the time, of course. And I remember the person on the other end of the line kept saying, like, they were asking all kinds of questions about me, and like I couldn't even formulate what they were asking. And they had said to use the inhaler again, and I'm like, no. Like, I was trying to say, like, I can't use it again. I can't, because I truly believe I'm allergic to it. I know that's what had to have happened. There was no way anxiety got to that point, because I've had horrible panic attacks, and it was just the point I could not breathe. So then I was just begging for the paramedics to get there. I'm like, where are they at? How is it taking so long? And I was just completely panicking. And then they got there, and I was just embarrassed by everything. Of course, by the outfit I was wearing and everything. I was miserable, but still, of course, I thought about that. And it was terrifying. It was surreal. And the paramedics walked in after I watched the ambulance back up in the driveway. And they gave me oxygen, and they're telling me to calm down and everything. They weren't putting it on anxiety just yet. And that was at the point where I was told there's absolutely no way anyone could go with me. It had to be just myself. Because of the coronavirus, I wasn't allowed anyone to go with me. And I had never been in an ambulance before. I have crippling anxiety. I just had a panic attack. I just went through the most scary thing ever, where I could not breathe. And then I was learning I had to go by myself on this ambulance to the hospital, to the emergency room. It was horrible. So finally I realized, like, I don't have a choice. So they gave me the oxygen. They got me into the ambulance and I went to the hospital. And when I got to the hospital, I was just panicked because I didn't want to be by myself, but the paramedics were really nice. But when they took me in the hospital, all of the nurses and everyone, they just completely stopped what they were doing. Like, I don't know, it felt like a movie, a TV show or something. Like, I look at the paramedic, I'm like, why do I feel like I'm on Grey's Anatomy right now? Like, they completely stopped what they were doing and they were just staring at me, and it was like, it was rude. It was very rude, but it just was all surreal. And then the treatment at the hospital was absolutely awful. And as soon as I got there, they took me off of the oxygen, and I was like, listen, because he was about to leave me then, and I'm like, listen, I am telling you, this isn't anxiety. I've had anxiety. This is not it. I'm like, it feels like there's something in my chest. It feels like I can't breathe. And he's like, listen, this is your anxiety. You can check your numbers over there. Your oxygen level is nearly perfect. He's like, I'm not giving you oxygen back. This is anxiety. You need to calm down. And ever since after that one, each doctor, nurse, whoever that came in, they were questioning me, and like, they were saying like, are you seriously here for a panic attack? First of all, if I was there for a panic attack, I should have been treated as any other patient, especially if it was my first panic attack, because they're horrible. Horrible. You feel like you're dying. Okay, but I wasn't there for a panic attack, and they acted like I was. But like I said, even if I was, they should have never. Just the treatment was so horrible. And I feel so bad for people, because I have the horrible anxiety, and I was there by myself dealing with it, and how rude the people were. And I tried to be understanding, because I know that they have a very difficult job. It's not easy, especially now while there's all this panic around COVID-19. I understand that. But for someone like me who was in there like terrified, and just, I had no one there. I don't know, like, I tried to see their perspective, but it would be nice if maybe they would try a little harder to see their patient's perspective. And it's nothing against nurses or doctors, but just, you know, the line of work that you're going into when you choose that field. And it was just, I mean, anxiety aside even, it was the worst I've ever been treated. And the one guy, I think he was a nurse, he came in and he's like, okay, well, you have to change into the hospital gown, of course. After he already like took my shirt, like he was looking everywhere to like tape everything to check all my stats and everything. But so at that point I'm like, okay, what's the difference anyway? But he's like, here, he held something up, and he was taller than me too, so he's like, here, you have to change right here. And he's like, I'll hold this up and try to at least let you have some dignity left. And I'm like, but still at this point I was in shock over everything anyway. And I just changed outfits in front of him, and I shouldn't have, and something needs done about everyone there, seriously. Like, I feel violated on just about every level possible. And also I can understand why they didn't want to come like too close to me, because I was at risk of having coronavirus still. I didn't get my test results back yet at the time, and I did have all of the symptoms, but I was in the ER from an ambulance, and they didn't check anything. I had a mask on, and they didn't check anything. They didn't check, like, they didn't look at my throat, nose, ears, nothing. Like, they did do a chest x-ray. They checked my lungs. They said it looked clear. I have no idea how, but I'm very thankful for that. And that was it. And they just kept saying, they did say it was bad bronchitis, but everything else, they just dismissed it on being anxiety. The thing that really got me was, they were like, well, have you ever had a panic attack? And I'm like, believe me, I'm like the queen of panic attacks. Yes, I've had them for over 10 years. You know, they knew my age, so I could have said exactly how long. They definitely started when I was 13, so I'm 26, 27 this year. Like, yeah, I know what a panic attack is. And it was like they were testing me. It was like I had to give a resume for my experience of anxiety. They're like, okay, well, if you've had a panic attack before, then you won't mind telling me what it is. And I'm like, do you see me in here right now kind of freaking out and everything? Like, these are the panic attacks I get. I'm like, yeah, it gets worse to the point where I get hyperventilate, can't catch a breath, everything else, but I could not breathe. Like, it got to the point I could not breathe. I started to pass out. I was like gasping for air. I couldn't even gasp at that point. Like, I could not get a breath. And they just didn't want to hear it. I had a rash all over me. Like, this whole thing was red. Of course, the only place they would look on me with a rash, you want to guess where? Chest area, let's say that. I mean, I had it on my face, but of course I had the mask on, couldn't take it off, which I understand, but everything about it was so horrible. But all I could think about was, guess what I'm doing? More strength from the madness. I was like, I gotta tell this story too. Nobody's gonna even believe I've been through half the stuff I've been through to even talk about it. It's crazy. But that was my first experience of 911 having to be called for me, and going in an ambulance by myself, in a hospital by myself. I've never even gone to a doctor's appointment by myself, let alone the emergency room. It was so scary. But I'm not trying to scare anyone out of that part though, because if I was able to do it, then anyone can, seriously. And then ever since then, I've been reliving it really bad. Like, I know it's PTSD over it. It might sound crazy, but it is. I keep reliving that feeling of not being able to get a breath, that I couldn't breathe. So then I'm afraid I'm gonna get a panic attack to lead me to that point of it being so bad. So I've had panic attacks daily again. Not such a gentle reminder of how bad they are. Because it had been a while. I haven't had a panic attack in months. Seriously. And maybe I needed it to remember just how scary and bad it is, because I was like, listen, if this is gonna keep happening, I can't. Like, I just can't. I was about to just give up. I was ready to seriously give up. But I didn't. I've been just dealing with it and getting through however I possibly can. But panic attacks are so scary. They are so scary. And the worst part is when you realize that you have to take it on yourself and take the control and power back over it, because really you're the only one that can get yourself through. Because I was afraid to even be left by myself for a long time, because when it happened I was with people and they were able to kind of like try to calm me down as best they could, but really it's just me. I'm the only one that can calm myself down. And it's so hard to do that, especially once your mind starts going. And my problem this whole time around was that it's not necessarily even something to be anxious about. It's just everything's been so different with this coronavirus going on. You can't go places and more people are here at a time, and just everything has been so different. There hasn't been work available because of it. It's scary too. And every time you see the news or social media, you see all the people who are dying. If you're lucky, you'll see the people who are surviving it. That's always good news to see, but usually it's only about the deaths, and it's scary. So then when it's that, plus being sick, feeling like you can't breathe on top of it, that was my problem this time. But yeah, so that was my first experience with calling 911. I didn't call, but it was called for me. It was just an experience that gave me more strength.